Have you ever noticed a sudden pain over the face, an unbearable pain over the face? This could be trigeminal neuralgia. Hi, I'm Dr. Raveesh Sunkara, a neurosurgeon based out of Hyderabad. I've treated multiple patients with trigeminal neuralgia. Let me tell you with this experience that this is the most undiagnosed or underdiagnosed problem that I treat. Because a lot of patients that come to me, I see that they have been going to multiple places, getting multiple treatments, multiple diagnoses, only to get disappointed. Today, let us try and discuss completely about this trigeminal neuralgia. Why this happens, what can be done about it, what are the treatment options, and what can you expect out of these treatment options. Before you understand what is trigeminal neuralgia, you need to understand a little bit about the trigeminal nerve. Trigeminal nerve is the fifth cranial nerve. It is responsible for carrying the sensation, the feeling of touch or the sensation from the forehead, cheeks, jaws, gums and lips area. This is divided into three main branches. We call it the ophthalmic, maxillary and mandibular branch. Simply V1, V2 and V3. So all these three branches carry these sensations from the face and they supply it to the brain. Now, when this nerve gets irritated or compressed by something, that is when this electric shock like pain comes. The most common reason for this is a nerve getting compressed by the blood vessel inside the brain. Usually we see that the pain affects only one side of the face. Attacks can last from a few seconds to a couple of minutes. Sometimes, in few rare cases, they may last for hours or days together also. These patients usually are so depressed that they become suicidal as well. That is the reason sometimes we call it suicide pain. So why does this happen? Like I said, the nerve is compressed by something. Most commonly, what we see is a blood vessel, usually an artery, that is compressing this trigeminal nerve exactly where it enters the brainstem. So this nerve over a period of time, by this blood vessel getting compressed, gets damaged. The outer layer of the nerve, that is the myelin of the nerve, gets damaged because of this continuous compression by this blood vessel. Once this happens, there is a misfiring of this nerve leading to such intense pain signals. Some other causes include multiple sclerosis, when nerve insulation is lost due to demyelination. Sometimes some tumors like meningiomas or acoustic neuromas can press onto this nerve and cause this pain. Whereas in some patients, unfortunately, we are not able to even find an obvious cause. I would like to stress one important point here, that this is not a dental problem. The reason why I'm stressing is many patients who come to me, I've seen that they undergo multiple tooth extractions thinking that this is a dental problem or a toothache. But actually the real cause is a neurological issue. So what are the symptoms of this trigeminal neuralgia? Sudden stabbing, shock-like pain over the face, usually in the cheek, jaws, gums or lips. Usually this is unilateral or one side of the face. Then pain is usually triggered by simple activities like brushing, eating, chewing, sometimes talking, washing the face. Some patients even say that even a light breeze when they're traveling on a bike or a car suddenly causes this pain. These episodes can be repetitive, sometimes lasting for seconds, minutes, sometimes even days. So sometimes some patients stop completely eating or doing their even daily activities. So what are the treatment options for this trigeminal neuralgia? Please understand the first line of treatment option is always medications. The gold standard drug here is carbamazepine, which basically calms down the firing of abnormal nerve. Alternatively, sometimes we can give oxcarbamazepine, gabapentin or baclofen. These drugs are effective initially, but sometimes their effect may reduce, or sometimes patients might have constant side effects like drowsiness or imbalance. Some patients might start having metabolic issues like liver issues because of increased dosage of these drugs. Whatever may be the reason, if the drugs are not effective or causing some side effects, that is when we start thinking of other treatment options. Next, let us discuss about the treatment options when such medical management fails. Please understand that the gold standard option is always microvascular decompression, especially when there is a vascular compression clearly seen on an MRI. In this microvascular decompression, what we do is a small craniotomy behind the ear called a retrosigmoid craniotomy. The vessel that is compressing the nerve is identified, and then an artificial material is placed between this blood vessel and the nerve, thus buttressing it and relieving the pain completely. Please understand that microvascular decompression directly addresses the root cause and offers a really long-term pain relief in most of the patients. Next treatment option is radiofrequency ablation. Radiofrequency ablation is a minimal invasive procedure in which we pass a specialized needle under image guidance and use RF waves or controlled heat waves to destroy the nerve fibers, thus reducing the pain. This is usually taken as an effective and a quick procedure, especially in patients who are unfit for a major surgery like microvascular decompression. The third option that is gaining a lot of popularity these days is gamma knife radiosurgery. Although this is a completely non-invasive treatment, meaning we are passing focused radiation directly to the nerve root. It is painless, there is no incision, the pain might come down in a few weeks. But please understand that the data supporting this is still very limited and moderate success can be expected compared to a gold standard procedure like microvascular decompression. Other techniques include glycerol injection, balloon compression. These procedures are not commonly done these days and are slowly phasing out. Please understand that trigeminal neuralgia is very painful, unbearable pain, also known as a suicide disease by some authors. But with modern medication, advanced neurosurgical options, patients can achieve a complete pain control. The key is to diagnose it early and give a proper treatment by a specialist. Trigeminal neuralgia is a devastating but treatable condition. If you or someone you know is struggling with repeated facial pains, please consult a neurologist or a neurosurgeon early. With today's treatments, we can help patients return to pain-free, complete normal life. Thank you for watching. I am Dr. Raveesh Sunkara. Don't forget to like, share and subscribe for more insights into brain and spine health.